out of bed to go to the washroom and come back, that's going to affect your sleep. You must remember that sleep, there's a cycle. It's called a rapid eye movement alternating with a non-rapid eye movement. So you get cycling between REM and non-REM sleep during the night. Now, every time you break that cycle to go to the washroom, or you have pain, or you have spasticity, you restart that cycle. So you may think you had 8 hours sleep, and you say, well, I went 8 hours sleep, but I don't know why I'm feeling tired. Then if you think back and you say, well, I went to the washroom twice. You've broken that cycle, so you may have had 8 hours sleep, but you've actually had 2 hours sleep. So I often ask patients when they tell me they're fatigued, the first thing I ask them is, are you sleeping well? And they look at me and they say, what do you mean am I sleeping well? I'm saying that I'm fatigued. And this is the reason I ask that question, is because often if you don't have a good sleep, or a truly good sleep, then what happens is it spills over in the day and you have an increased amount of fatigue. Now, various causes for that sleep problem. Pain. Pain is a huge part of multiple sclerosis. In fact, a topic on its own, but there's a huge overlap between pain and fatigue. Sensory disturbances. Some of you were diagnosed with this at the beginning, at the outset. You had paresthesia, numbness, tingling. You couldn't figure out what was causing it. And sometimes you have neuralgias, spasms. All of them can interfere with fatigue. Presence of nighttime pain can cause daytime fatigue, and visual analog scale can also be used to assess this. The other aspect, when I'm speaking about dysesthesia and paresthesia, I often check my patients for B12 deficiency and simple things. So sometimes it's actually a contribution to MS-like symptoms, but it's actually an easier fix. So just on a side note, so it's good to actually have your B12 checked as well. Physical deconditioning is a huge part. This results from failure or inability to exercise that would lead to fatigue. Patients that experience increased weakness, experience decrease in aerobic capacity, even in patients who are immobile. So I can't emphasize this more, because what happens is it's a vicious cycle. You find that you wake up, you're tired, you don't want to do any exercise, this is not your day. So what happens to the muscles? The muscles are being deconditioned. The muscles are being deconditioned, and as a result, it actually leads to anaerobic capacity as opposed to aerobic. And it's just a vicious cycle, so it gets worse, the muscles get stiffer, and everything gets worse. So as MS patients, you know that at some point, if you had some ailment or you had some problem, for instance, you had a cold and you were in bed for 2 days, you find that when you get out of bed and when you start activity, you're already experiencing some stiffness that was not there before you started off. And the reason for that is because you're getting deconditioning, physical deconditioning. You gotta exercise every day. So even patients that are wheelchair bound, you don't use your arms and you don't use your muscles, it's gonna get worse. This is the dreaded disease of MS. And this is what you're gonna constantly fight. You're gonna fight more than the normal population, unfortunately. So every day, exercise is extremely important. Medication use is a huge problem, and it's a big problem in terms of some physicians don't have any problems just prescribing medications. Some of my patients come in with baskets full of medication, and all of them have an interference. So there is a place for medication to treat specific symptoms, but often there may be an abuse of medication, and that's also contributing to your fatigue. So remember that. So you want to clean out that medication closet and take what's absolutely necessary. And I'm going to show you some of the ways that you're going to be able to do that without using medication, and there's been some evidence to that. So amongst the most common ones are the opioids, the antispasmodics, sedatives, anticonvulsants, antihistamines, and antihypnotics. So all of them can contribute to fatigue. So what is the practical impact for you guys? Yes, I spoke to you guys about fatigue, about the definition. Yes, it's true, it exists. But how can you improve your symptoms of fatigue? without taking more medications? Is there a way out? So some patients choose to face the diseases head on, and they do better. And this is from my experience. And other patients choose to cower in a corner of a room, and they do worse. So how can you improve some of your symptoms? And there's actually been studies. So is there light at the end of the tunnel? Yes. There is evidence of neuro rehab can significantly benefit patients. The evidence is overwhelming. So in fact, I just returned from a conference in Europe, the ECTRIMS conference on MS, and some really nice papers and evidence-based medicine showing good data that patients with neuro rehab without any medication have improved. There is evidence. And I'll try and show you some of that. So this is one of the latest updates from ECTRIMS October 2015, 2 weeks ago. And I chose deliberately to go to some of these talks where they spoke about how patients' conditions and symptoms have improved without the magic drug. Everybody speaks about the magic drug coming in 10 years and 20 years and stem cell and all of that. But these are some of the practical aspects I'm going to speak to you about that you can actually go home and start using from day one. And I guarantee you, and it's been shown in the past, that there is benefit to it. Proof, yes. That's a functional fMRI. Functional fMRI, pre-therapy patients, you can see that area is lighting up there. Post-therapy patients, you can see that area is lighting up on that side. Definitely a difference. This is fascinating. This is fascinating because with just therapy, new areas of the brain are lighting up. What does it tell you? That tells you that the brain can relearn, can reroute different areas. So there is a possibility of plasticity and rerouting in multiple sclerosis. There's the evidence. It's showing you that it's happened. Pre-therapy, post-therapy, it's happened. I'm sure if you saw a drug like this, everybody would be running out to go buy the drug, right? This is showing you that you can do stuff on your own and improve. And this is a functional MRI. And I'll show you some of the data and some of the stuff that we've actually done. Very simple things that you can actually do at home to improve some of your MS. Cognitive functioning. You know, cognitive functioning is a very difficult aspect in MS, and the problem is that there's no good cognitive assessment tool that you can do quickly to assess MS patients. What we have, in fact, I've got this challenge with the health region. In fact, because when I have patients with Alzheimer's disease, then they have to follow a certain score to be approved for certain drugs, for even Alzheimer's disease. I don't know whether most of you know that. So there's quite a few different tests that we can use, and I've written several letters, and they've come out with this mini mental state assessment, which is a 5-minute test, which I think a grade 5 child may be able to score much better on that test. The problem is that when it's subtle changes on cognitive functioning, these tests are useless. You have to have a better test. But unfortunately, they don't allow us to use the other testing. But in MS patients, they found that studies have shown that MS patients, even with mild cognitive impairment, so you must remember that you may be functioning fine. A lot of you may be in nice jobs and you may be functioning optimally, but you know that you're not functioning the way you used to. You know that 10 years ago, when you were at school or you were at your same job, you were much sharper, and now for some reason, you've gone down. So what have they shown? They shown that brain exercise studies were conducted over 12 weeks, just 12 weeks, so just 3 months. 1 hour per day. Tests included memory, executive functioning, comprehension, and speed. And there was almost a 40% improvement in patients' cognition. And this was demonstrated again with a functional MRI and tests indicating that there was almost a 40% improvement in patients. This is where we all are guilty of. See, you go through 12 years of confined education or you go conformed education, you go through school, you go through grade 12, and you may do some tertiary education after that, and some of us are still studying. But people continue. What happens is, then you get into a job. You get into the job and you start doing the same thing almost every day. You get used to it and it's in a comfort zone, right? But think back when you were in high school. We used to complain about tests and examination, but your brain was constantly challenged and you were using it. Every other day you were learning something new and you were using it. But for the last 10, 15 years, you got into a nice comfort zone and you just say, well, I'm just slow. I can't think anymore. But what are you doing to improve that? This test shows that the brain has this entity called plasticity. You still can improve. There were some patients above the age of 60 in the study which showed that they actually improved with just simple cognitive exercise. Simple. So I think that's really, really exciting for me, because I think that shows that you actually have the ability. You don't have to wait for a drug. What I'm telling you is, it's actually within you, but it's how much you put into it. So what can you do? Every day, we're a bit lazy, but you have to spend at least for an hour. The data shows 1 hour a day. It was only done over a 12-week period. Can you imagine doing 1 hour a day for the rest of your life? 1 hour is not much of your time. We go to the washroom, we probably spend more time. We go to the shower, we spend more time. We sit at the TV, we spend more time. But we don't exercise our brains. Memory games. Lumosity is an excellent game on computers. Sudoku, crosswords, puzzles, whatever you can get your hands on, you've got to challenge it. Unfortunately, you have MS. You're not like the rest of the population. They have the luxury of not having to exercise the brains because that circuit, that highway is flowing smoothly. There's a huge crash on your highway. You've got to find another way to actually get past that crash. If you don't, it gets worse. What happens? So if you don't use it, you're going to lose it, unfortunately. Balance. And this was an interesting study that I saw, and it was nice data by an Italian school. They actually put together 250 patients, and they actually used a simple device, the Wii Balance Board. And I was really, really fascinated about this study, because what they did was they did daily sessions. So they chose patients who had balance problems, patients who came in and had balance issues. So they chose more than 200 patients, and they said, let's use the Wii Balance Board and see how they improve. So they did functional MRIs before they started the actual trial, and they did it post. So just 30 minutes a day, and this went on, I think it was for about 6 months. And it showed an improvement. Now what's amazing about this study, what I found was fascinating, is that your balance is controlled by that part of your brain called the cerebellum. The cerebellum controls balance and your brainstem controls balance. Now what I found was fascinating about this study is when they did the functional fMRI, before the study, it showed that there was hypometabolism, there was decreased function in the cerebellum, and there was decreased functioning in the brain. When they did the study after, they didn't show an increased activity in the cerebellum. They showed other areas of the brain was lighting up. And I find that's amazing, because that means even if one area in the brain that does one particular function is damaged, other areas are trying to take over that function. So again, this concept of plasticity exists. And those patients actually improved with balance. And again, this was a short study over a 6-month period of time, but it shows that you have the ability to improve. Just neuro rehab. And I find that was fascinating. Gait. Gait was also studied. So a team from London actually came out, and they didn't want to cloud up the data. So what they did was they only chose patients in the hospital. Because obviously if they're testing something like walking and how much of activity you're going to do, if you're going to go to a trial site, that time where you rush into the trial site, all has to be accounted for. So what they did was they made it easier. So they took patients just in the hospital. They took them all and they put them on the treadmill for what, 30 minutes. The physiotherapist did this. 30 minutes treadmill and then 2 25-meter walks, and again an improvement in the patient's ability to tolerate more activity, and functional MRI showed an improvement. So I find that's fascinating. I think that, can you imagine if I was presenting this data with a new drug? You would have been wanting to go buy that drug tomorrow. But this is something that you actually have the ability to do on your own, in addition to whatever drugs that are out there. So almost all areas that are affected can improve. Unfortunately, these data studies, like the cognitive assessment that I'm doing, they're not funded by any drug companies or anybody else. So the funding is more difficult to come by to do this studies. Because it's not going to put money in the companies or anyone else, right? So I think these are more difficult. These are things that we've seen little studies and we've seen improvement, and there is light at the end of the tunnel for you. So what about drugs? Yes, they are drugs. They are drugs for cognitive improvement. So if you're having significant cognitive improvement, in fact, London, Ontario has tried it in a few drugs now. There's one drug that I tried in some patients as well, for example, that improves balance, like Fampura. But they're also looking at now how it can improve cognitive functioning. So there's some drugs, there's modafinil, there's antidepressants, there's Symmetrol. And for spasticity, there are things like baclofen, benzodiazepines, and you can go down that list. And you can also have neuromodulation, where they insert neuromodulator to improve some of your spasticity. All of that actually helps. Pain, gabapentin, Lyrica, antiepileptics. So in summary, yes, fatigue does exist. So those of you that were doubtful, I hope I managed to convince you that it is a true entity that exists. There are multiple cofactors that contribute, and you can improve your symptoms without any pharmacological methods, just on your own. So it's up to you about how you approach this monster. It's difficult, it's easy for me to stand here and tell you, well, it's easy to handle it head on, so it's a huge psychological hump. You've got to get over that camel before you can actually get going and try and improve your own symptoms. And that's my talk.